Let's discuss about primary biliary cholangitis, formerly known as primary biliary cirrhosis. It is a progressive autoimmune disease characterized by fibrosis and obliteration of the intrahepatic bile ducts, potentially leading to cirrhosis. Primary biliary cholangitis is most common in women of Northern European heritage with typical onset at age 30 to 65, with the risk increased in the family members. Patients are often asymptomatic at the time of diagnosis, with abnormalities noted on the liver function test done for other reason. Fatigue and pruritus are the most common symptoms, but patient can also develop jaundice, steatorrhea, hyperpigmentation, and hyperlipidemia with xanthelasma. Xanthelasma is cholesterol-rich skin deposits usually seen around the eyelids. Patients may also have other autoimmune disorders, for example, type 1 diabetes mellitus or maybe CRASH syndrome. Primary biliary cholangitis is characterized by significant elevations in alkaline phosphatase ALP, which reflects cholestasis. Mild elevations in bilirubin and hepatic transaminases like AST ALT and may also be seen in these patients. Anti-mitochondrial antibodies are highly sensitive and specific for primary biliary cholangitis. Liver biopsy can confirm the diagnosis and provide staging information, but it is not necessary in patients with typical clinical and laboratory findings. Ursodeoxycholic acid can slow the progression of primary biliary cholangitis and improve overall and transplantation-free survival. The only curative treatment is liver transplantation. Primary biliary cholangitis can reoccur following transplant. However, if it does reoccur, it tends to have a slower progression. Talking about the complication, the metabolic bone disease such as osteopenia and osteoporosis is a frequent complication of primary biliary cholangitis. Its cause is unknown, although its increased prevalence amongst patients with PBC may in part be due to its predisposition to affect female patients who are frequently postmenopausal and already at risk. As primary biliary cholangitis progresses, cholestasis can cause toxic accumulation of substances that inhibit the bone over turnover. Vitamin D levels are typically normal in this patient, with the exception of those with extreme advanced cases due to severe protected cholestasis causing fat malabsorption. Therefore, it is important to screen regularly for osteoporosis, example using bone densitometry in such patients. Calcium and vitamin D supplements are generally recommended, and bisphosphonates, for example, alendronates, are indicated for those with established osteoporosis. Osteomalacia, there is a decreased bone mineralization, can sometimes be seen with primary biliary cholangitis and typically associated vitamin D. Thank you.